Yes, seeing the document, right?
Oh, this?
Yeah. Are you seeing the document or has it gone from sharing?
Yeah, I can see. Sharing.
Okay. So the third drug for today is Lilium tigrinum or Lilium tigrinum. The common name is tiger lily, belonging to the family Liliaceae. Now, just remember what we told in Helonius. It's also Liliaceae. Arctus is also Liliaceae. Lilium tigrinum is also Liliaceae. And all these remedies are having or a good indicator or good indicated medicine for uterine prolapse. The part used in case of Lilium tigrinum is the tincture of fresh stalk, leaves, and also flowers. So from the Allen's Materia Medica, in Allen's Materia Medica, itself, Lilium tigrinum has been given a lot or enough. So when coming to exam point of view, that alone will do. The mind, the heart. In case of this drug, Lilium tigrinum, the mind symptoms are very characteristic. It can be individually acts like sepia mind, lachesis mind. Even Lilium tigrinum mind is so characteristic. And then they do have the female complaints, the uterine complaints. So FRS is important, and also they have heart complaints also. So Lilium tigrinum heart can also be asked. So either short notes any of this or Lilium tigrinum as a complete essay could be asked. So in the mind, they are very much tormented about her salvation, which is a characteristic feature of Sorinum, Lycopodium, sulfur, veratrum. Should put Sorinum also. This is actually what is comparison given in not, but Sorinum is also important. Tormented about her salvation, as you know, she feels that she is going to die, and she's not sure whether she will be going to hell or heaven, thinking whether she will be getting her salvation. So she is tormented about her salvation, and we have that much remedies with who are having that characteristic symptom. And this, along with, they will be having some ovarian or uterine complaints. For them, consolation aggravates. Uh, there is a wild, crazy feeling on vertex or confused ideas. So, the explanation, what the provers used to say is they're having some crazy feeling, some kind of varied sensation, which they are not able to put into that. So, this wild, crazy feeling, when we read that single sentence, wild, crazy feeling on the vertex, we would be like, what it means, what is this wild crazy feelings. So in Clark it has been explained that when the provers when the proving of this drug was done, the patients used to give such a lot of wide variety of sensations, and sometimes they were not able to explain exactly what sensations they are feeling. They used to feel something which they are not able to put in proper words. The better way to put that or explain it was the patients or the provers were always having many confused ideas. They were not able to concentrate on one particular topic or something. It was confused always, but not the jumping off talking like in lachesis they are jumping from one topic to another, and that is actually we are witnessing when they are talking. But in case of Lilium tigrinum, they are also confused, jumping one to another. They are not exactly able to concentrate on one particular point. They will be just confusing and going on, and that is the way the clerk has explained how this a wild, crazy feeling of the provers of Lilium tigrinum. They were having a lot of confused ideas, inability to concentrate on one particular matter. That was the thing. Then, as I already told, all the medicines which are having uterine complaints, obviously they are going to have much depression. So, as like in Helonius, what we saw here, also we can see profound depression. They can hardly avoid weeping, very timid, fearful, and weeps very much. When we say this much sentence, the profound depression, or can hardly avoid weeping, very timid, fearful, and weeping very much, one of the medicine that will come into our mind will be pulsatilla. But then, so these symptoms like that, she's very timid, fearful, weeping much. Yes, that matches. There are characteristic differences. The one thing, in case of pulsatilla, consolation is very much amelioration, but in case of this one, Lilium tigrinum, consolation is actually aggravation. So that itself is a very characteristic symptom. And in case of pulsatilla, she'll be very happy that to be in company and someone is loving her or doing things for her. She will be extremely appreciating that. But in case of Lilium tigrinum, much like sepia, they will be indifferent about what is being done for her. And in case of sepia, that indifference is actually towards the persons rather than the things being done for her. She is having that indifference to the activities she used to love once upon a time in her life, or to the persons who were very dear to her once upon a time. Once upon a lifetime. But here in case Lilium tigrinum, they are not having that indifference to the activities they're doing or their loved ones, or not to the people who they are in their life. But whatever we do for them, in case of Lilium tigrinum, they won't be happy. They will be still, very indifferent. They simply don't care, or they're not happy with whatever we try to do for them. So they are very indifferent about what is being done for her. They do have anxiety about the disease, fear that symptoms indicate an organic affection, and it is marked in both sexes. And this one is actually not just a sensation or a fear. We can see that the patient is actually having some or the other heart complaint. This is a very good remedy which we can think about in case of angina. So they do have some organic heart disease. So it is not just they are very anxious about their disease, or they think that there can be some extreme pathology. It's not just a fear, but in fact, in their body also there is organic affections that is being seen, and they will be having a disposed to curse, strike, to think obscene things, alternating with urination. And when we say the disposed to curse and strike, this is seen in case of anacardium and also in case of lacanine. We will be dealing that drug in the next class. So that cursing and striking can be seen in this medicine, and also the obscene things. And now obscene things, we can go for the hyoscyamus, ammonium, and lysine, uh, lacaninum. But here, when I was mentioning about the prolapse and the sexual desire, Lilium tigrinum I had put in actually nymphomaniac or high sexual desire. So that sexual desire, it's manifested even in the mind, thinking obscene things. They are very listless. Listless means there is a lack of energy, but they cannot sit still. They're very restless that they want to move about, yet they do not want to walk. So see this sentence. They're very listless. They don't have energy, but still they don't want to sit calmly. And they are very restless that they want to move about, but they don't want to walk. And now this symptom we can actually connect to their wild, crazy feeling. Like as I already told, there are so many things going on in their mind. They can't concentrate something. They will be having this confusion. We can connect it to that. Like this is like they want to sit. I mean, they lack energy, but they don't want to sit anywhere. They want to move about. They're very restless, but they don't want to move about. So always a confusion that in their mind and also in their activity, we can see that. They have high sexual desire. So to forget that sexual desire, they should keep themselves very busy. They have a desire to do something in a hurried manner, but it is like doing things, but there is no particular aim for it, no particular goal for it, no ambition. It is completely aimless. It is like they want to do things, they do very fast enough, but they don't have a particular goal or an ambition to do that. So this also is another symptom that we can connect to their crazy feeling or their confused ideas or their lack of concentration on something. And this symptom you can see in case of agendum nitricum also. There is fear for sitting alone, that they will be getting insanity or going to be mad. Heart disease, fear she is incurable, some impending calamity or disease is there. And this headache and mental ailments depend on uterine irritation or displacement. So this is the mental features where they are tormented about their salvation. They're very profoundly depressed, extreme interest in sexual matters, that they have to keep themselves busy to forget those sexual thoughts. The consolation is aggravation, always in a confused state, various sensation of thoughts going on, cannot concentrate over any work. And then they do have that fear to sit alone, that they are having some organic disease. And this characteristic feature that they are lacking energy or listless, that they don't want to sit anywhere still. They are restless, they want to move about, but still they don't want to move about. And then the anacardium feature of striking, cursing others. They are indifferent for what is being done for her, and all these fears will be there. And one another feature of this drug is actually it's coming somewhere later. The mental symptoms and the physical symptoms alternate. And these mental symptoms are usually reflex of the uterine complaints. Physically, this is mainly affecting the left side of the body, like lacasis, lacaninum, thuja. This is affecting the left side of the body. You can also connect it in the manner like this is a heart remedy. So it is affecting the left side of the body. However, when we go later, we'll see the angina. It will be radiating, the pain will be radiating towards right arm. They cannot walk on uneven ground. There will be pain in small spots, which is constantly shifting. And now when we take this symptom, this is also similarity with pulsatilla. But other remedies are also there. Calibicromicum is also there, and also the lac caninum. In cardiovascular system, uh, there is a sensation as if heart was grasped in a vice, like the cactus. When we are saying about the Helonius drug and why Farrington, right? Farrington gave the medicine for that lady when she said the symptom of the heart, not the heart, the chest being tightly screwed in a vice. I don't know whether lilium tig was proved by that time or not. That's also a symptom because that's also prolapse, and this symptom is also characteristic of lilium tigrinum. Maybe it was not proved, I don't know. But that symptom, which was seen in Helonius, the male provers, we can see it over here. So this is a remedy which is having that exact sensation of cactus and the Helonius, where the heart was grasped in a vice and it is twisted and twisted. A typical pain that we feel during angina, the heart being crushed, that we can say. As if the blood had all gone to the heart, it feels full to bursting and inability to walk erect. There can be pulsations that is felt all over the body as if all the vessels have got distended, and we could feel pulsation everywhere. And now that same feeling we can see in aeschylus. In aeschylus also there is congestion in different parts of the body, in heart, lung, rectal region more, because of that they have the hemorrhoids. But in all the other parts of the body also, in stomach, abdomen, they can have that full sensation as if the veins are distended and then there is a blood bursting sensation. So we can see that in lilium tigrinum also. And in cardiovascular system, there is palpitation, fluttering, faint, hurried, anxious sensation about the apex region, the angina. The sharp pain in the left chest awakens the patient at night. There is irregular pulse, but extremities, as like in angina, there will be coldness and covered with cold sweat. So they are given this much explanation, but it is typically indicating the angina condition where there is a palpitation, cold extremities, cold sweat, and that characteristic crushing pain which is felt in the left chest. And usually the pain of angina appears at night. Aggravation after eating, lying on either side. And if it is left side, mainly it is lacusis. We already told there is a palpitation, so rapid heartbeat, which is 150 to 170 per minute. Now, can you say me another remedy which is having such a high uh, heartbeat rate? Now,
Uh,
can you say?
Spigili. Okay.
Yeah, but I put P.
The
Yeah.
phosphorus.
Not exactly.
Let okay.
No.
The EY.
Correct. They are also having rapid heartbeat, but it is more related to the septicemic condition. Okay, it's not related to the angina, but the fever, the septicemic fever that pyrogen is indicated. They are having very high heart rate, and you told spigelia that is the third. And if it is low pulsation, what are the for low pulsation? There is for high pulsation of tachycardia. Pyrogen as spigelia. Low pulsation.
Digitalis.
And with cup, which is the remedy. Is Farah there? I think she's laughing and she has gone somewhere. So in GIT, this drug, they have a constant desire to defecate and urinate due to prolapse or from pressure in rectum. Now, uh, as I always told, this is just exam based. The explanation why all these symptoms comes up will be dealing later. Urinary system also, as we already told, though there is a frequent urging to urinate, and if desire is not attended, there is a sensation of congestion in chest. In female reproductive system, there is headache and mental ailments depending on uterine irritation. There is menstrual irregularities with irritable heart. So, in case of Lilium tigrinum, can imagine a patient who is having uterine complaints, mental complaints, and also heart complaints. And this mental and physical symptoms will be alternating, as like in platinum. There will be a bearing down sensation, the uterine prolapse, which is felt in the abdomen and pelvis, as though all organs would escape. Now, this needs an explanation. It's coming later, but I'll say you over here. In case of Helonius, when we are saying about the prolapse, we concentrated on the prolapse of the uterus or that dragging sensation which is felt in the uterine region and as if the uterus is getting prolapsed. Now, if we had to compare, because we have seen that Helonius will antidote the Lilium tigrinum prolapse. Now, if we compare the prolapse of Lilium tigrinum and Helonius, in Helonius, this prolapse is concentrated in the uterus, but in Lilium tigrinum, they feel that that bearing down sensation is starting from the throat. Something that is coming or it is pushing down from the throat region itself. So even in the stomach, in the abdomen, in case of Lilium tigrinum, they feel like all the organs are coming out, not just the uterus, but every organ starting from the throat region have a tendency to protrude out. That is where the dragging sensation or the bearing down sensation of Helonius and Lilium tigrinum are getting varied. When we go to the other remedies, murex and sepia also, they also have this sensation, especially in sepia, the ball-like sensation that is felt, and they also have the sensation as if all the abdominal contents are being are coming out. But in case of Lilium tigrinum, it is starting from the throat. They feel like the things are coming out. But in Helonius, it was only the uterus that they were feeling about. And to prevent this bearing down sensation or the prolapse, in case of Lilium tigrinum, they have to support vulva with their hands. And in case of sepia, it is, what is the amelioration in case of sepia? When they have a prolapse, what do they do to stop that prolapse? What's a particular posture of sepia?
Crossing the limbs.
Crossing the limbs? Yeah, the crossing the limbs. No, sorry. Actually, they sit cross actually, so that they prevent the protrusion of this the contents, and that is the same position or the posture that is assumed by even murex also, crossing the limbs. But the only difference in case of murex and sepia, when we compare the prolapse, murex and sepia, okay, murex and sepia, the prolapse in case of sepia and murex are so
American University. I'm doing my BBA in this is a free consultation. May I know how is it like free?
the consultation is free, but you have to pay for the medicine. Are you a student?
Yeah, I'm a student.
Okay, then it will be free actually. You want to consult now?
Is it free? I just want to ask a few things about my company.
I'm not sure because now I'm taking class.
Okay.
Can't stop because
Okay, then when can I come?
can come tomorrow.
Tomorrow what time?
Anytime because I don't have class. Anytime between
Day after tomorrow?
yes, sure. Anytime between 8:30 to 5.
8:30 to 5. Okay, I'll come day after tomorrow.
1 minute.
Thank you.
Okay, so coming back, in case of this one, Lilium tigrinum, they have to support the vulva with hand, and it is cross-legging in case of sepia and murex. Much of the symptoms of murex prolapse and sepia is very similar. There are only two differences between murex and sepia. One is the sexual sphere. In case of murex, there is increased sexual desire, and in case of sepia, it is actually the indifference, or they don't have that um, sexual desire. And in case of menses, that is the second difference between murex and sepia. In case of sepia, usually they say any problem. If the symptoms are matching, it can be amenorrhea, menorrhagia, metorrhagia. That is how in sepia they explain. But usually in case of sepia, it will be scanty menses. But in case of murex, it will be very protracted menses. So that is another difference between murex and sepia, and they prolapse. So it differs only in the sexual sphere and also the quantity of the bleeding or the menstrual bleeding. Then in coming back to Lilium tigrinum, the menses is early scanty, but more than this, the important feature will be the menses flows only when they are moving about, like that of causticum. Once they are lying down or when she ceases to walk, the menses stops. There is a weak atonic condition of ovaries, uterus, pelvic tissue that result in anteversion, retroversion, or subinvolution. So indicating there is a weak atonic condition. And when we say androversion, I'm not sure why did they put androversion over here, because androversion is the normal posture of a uterus. So why androversion is over there, I'm not sure, but in all the Materia Medica text, I have seen this feature for Lilium tigrinum. And also retroversion, which is the abnormality or malposition, and also subinvolution. Do you know what is subinvolution? Subinvolution is a condition, I don't know whether I have put later. Subinvolution is a condition like during pregnancy, the uterus will be enlarging in its size. But once the delivery has been completed, during the puerperal stage, the uterus should go back to its normal size. And if it is not happening, that is called as subinvolution. So even in that condition, we can think about the medicine Lilium tigrinum. So there is slow recovery after labor. Always there will be constipation or inactivity. So these are the conditions where you see the normal position of the uterus when it is retroverted, when it is retroflexed, and also antiverted. Now going towards the body clinical Materia Medica. So when we go think about Lilium tigrinum, I know I have not explained much, but this is coming in later textbooks. So in case of exam oriented, as I already said, the mind is characteristic. The serious system, whether it's mainly indicated for angina, the particular sensation of the heart, the palpitation that is felt, the fullness sensation, the female reproductive system with that characteristic dragging down starting from the throat region, and that they have to support the vulva, the extreme sexual desire, and that is ameliorated only when they are busy in something, and the constant desire to defecate and urinate. Later, when we do lysinum, we can see such a symptom in defecation, the constant desire to defecate and urination in lysinum also. And in lysinum also, that we can think about in prolapse condition. We'll discuss that when lysinum comes up. So now going towards boric clinical materia medica. Rather than boric, I should go to some other remedies. Okay, we'll start with J.H. Clark. So the tiger lily, or this Lilium tigrinum, it was introduced into West from China and Japan. And this was a remedy which was first suggested by W.E. Piney. But this was not well-proved drug, the Lilium tigrinum. So Carol Dunham asked Piney to have it well-proved. And Piney did it. At that time, Carol Dunham himself assisted in this proving process. The account of this case, like how it was proved in a woman and what are the symptoms that were seen, that is explained in his book Science of Therapeutics. So what they did for the proving was they gave the 30th and also the third attenuation, and the patient took it for 10 days. The symptoms started to begin early, but was somewhat slow in the developing. But the feature was it was recurring. The symptoms were recurring. And while it was recurring, it went to that big extreme condition that they had to antidote that medicine because of the recurrence and the severity of the symptom. And this medicine was antidoted, the Lilium tigrinum proving was antidoted by Platina 200. So what were the symptoms that Dunham got while proving the remedy? It was developing in this particular order. So the patient was showing increased activity. And this increased activity we saw earlier when we were just saying that the patient was doing all the things very hurriedly, but they didn't have any particular aim. They were just doing things so hurriedly, but there was no particular aim or no purpose. Like an urgent anatricum, there was an increased activity, and which we can also connect to the confused state of their mind when they were constantly thinking, but not able to concentrate on one particular matter when they were thinking. They had an increased sexual instinct. We already told their nymphomania, and to prevent that nymphomania, they had to get busy with some other things. They also had a sweetish nausea with inclination, without the inclination to vomit, and abnormal fullness after eating even a little quantity. Now coming back, I'm not sure whether how much important this is. Uh, the other symptom will be the ill humor, which we have already seen that they will be extremely irritable person. They will be very indifferent to whatever we are doing to them. They have that tendency to curse and strike the people. So ill humored or always bad natured or bad mood people. They have the drowsiness. They sleep but with unpleasant dreams. They have the blotting sensation or that abnormal fullness, and this blotting sensation is more pronounced across the hips in uterine region. There will be pressure in vagina as if things are dragging out. The pain at the top of the sacrum extending to the hips. They have a crazy feeling with thoughts of suicide. So here is where the explanation comes that downward dragging, where Clark mentions that the most prominent symptom was the downward dragging, and it was not just of the uterus, but it was starting from even her shoulders, the thorax, the left breast, epigastrium down to the pelvis, as if everything out from there is coming out through her vagina. Later in the proving, a thin brown leucorrhea also appeared, leaving a brown stain, which was intermittent feature. The menses came at regular times, but flowed only as long as she kept moving. We saw that also in the symptomatology. Only when she is moving, when she stopped moving, even the menses stopped. She was always much hurried, driven, and she knows not why because of that confused stage, always doing certain things, but not sure. Then the heart symptoms came up, and that heart symptoms, see, it appeared only after 1 month after the commencement of the proving. There was a fluttering sensation or the palpitation, and she felt it very less when she was busy with other things. There was painless also associated with that, and the sharp pain in the apex of heart. Extremely, I mean, exactly explaining the angina condition. Then the Mendel symptoms, the new Mendel symptoms appeared after to this heart complaints were the obscene thoughts and also the disposition to strike and swear came up. But these Mendel symptoms came in this order when we are saying, but some of the Mendel symptoms like obscene thoughts, we have seen that over here there was an increased sexual instinct. And that we developed into a level of obscene thoughts in the later stage after the heart symptoms coming up. And when it was done in the male provers, they got this distress in the pelvic region affecting the bladder, rectum, and back, and also an increased sexual desire in males also. However, in males, it was the heart that was very prominent. So one man was saying his heart's action was intermittent, every intermission followed by a violent throb, causing an involuntary catching of the breath. At the same time, the blood rushed up through the carotids to the head, producing great heat and a crowded feeling of head and face. So, what we see, the order of the symptoms in proving is exactly what we learned over there in case of Lilium tigrinum. The characteristic feature that the pelvic fullness, this was more found in case of females. In males also were there, but then in case of males, it was the heart symptoms that was highly characteristic. But this heart symptoms we got in the females also, but in the males, it was more characteristic. And in S. Lilienthal, he says that some varied sensation, because we already told in case of Lilium tigrinum, there is varied sensation that is that the patient is feeling that they have that crazy. So he has told that there is a sensation as if a rubber band was stretched tightly from temple to temple, as if a skull cap were crushing the head, as if the brain was being pushed through eyes and ears. The outward forcing is a keynote of this remedy, and outward forcing is similar to what they say that dragging symptom. Then in the heart symptoms, they got actually the characteristic, the heart symptoms. There was alternate spasm and relaxation, like that being tightened by a vice. There was a pain and numbness, and also the third indication was an alternation between the heart complaint and the uterine complaints. The pain of Lilium tigrinum was wandering, flying, shooting. When we say all these things, we get the symptoms, the pulsatilla, lacuninum, calibi, that the pain was wandering, shooting, squeezing, relaxing, everything. But after to this symptom, the patient went actually into a recurrence of these symptoms. That is when they had to stop the proving, and they stopped it with platina. This symptom, the pain in case of Lilium tigrinum, especially the last sentence, from ilium to ilium or across sacrum, or the pain from hip to hip. This is very characteristic. Later we'll see some of the cases in which Lilium tigrinum was indicated just because of this radiation of the pain from one ilium to the other one. Across the hip, the pain was the for which Lilium tigrinum was given. Then a case said by Judge Clark was that a patient to whom I gave Lilium tigrinum 30 said it caused a sensation in the abdomen as if the contents were tied up in knots. Then another case was Lilium tigrinum giving a cure in case of uterine fibroid with all the characteristic features of the remedy by Sigmund Range. Another one, this prover had a complaint. Now, when we go to boric, it is explained over there. This is a medicine very good for astigmatism and also myopia, the short sightedness. So, when that proving was done, a patient who was having astigmatism, when proving was done, this complaint of astigmatism actually got aggravated during proving. But once the proving was completed, her astigmatism was gone. So see that thing. So Lilium tigrinum is having that symptom. There is a left side, the restlessness, which we explained earlier. There is a aimless hurry walk to and fro, but it is very aimless. Burning palms and soles, which is not that important. Complaints are ameliorated lying on left side. This is actually very important, very characteristic, because whenever we see a heart complaint, usually all those medicines will be having an aggravation of complaints lying towards left side. Because this is in case of lacuninum or phosphorus, the complaints aggravates, even tobacco. It is a left-sided medicine, can be given for heart complaints. And then pathologically also we know if the patient is having a heart complaints, when they are lying towards the left, there will be more flow of blood towards the left side where the patient will be having aggravation of complaints. So pathologically, it's a common symptom that if the heart is involved, there will be aggravation lying on the left side. But in case of Lilium tigrinum, that's the important feature. They have an amelioration lying on the left side. Then there is another condition, Berridge, who cured a lady of 50 years with a heart pain, as if grasps with hand, with cold feeling, uh, pain from apex of the heart to left scapula, aggravation lying on right side, but amelioration lying on left side and when busy at work. So I'm very doubtful in which side actually she lied over, because lying on left side is aggravation, and amelioration, yeah, amelioration lying on the left side and busy at work. With that simple condition, Berridge actually cured the condition. There is a hasty, busy movement which is ameliorating. Must cross legs to relieve the bearing down, or must put hands to vulva to prevent the contents escaping. Diarrhea, which there is present in the early morning, amelioration in open air, and aggravation in warm room. Another symptom that which is similar to pulsatilla. I never obtained good results from Lilium tigrinum until I gave it in the 30th attenuation, told by J.H. Clark. So he says, according to him, 30C is the best one. I have tried higher, but the aggravations from these were so severe that he has to give back 30. Then antidote is by platina, and this is one relation that we saw in case when they were proving also, where it was antidoted by platina, and another one is Helonius. And then for the uterine complaints, we did the comparison of lilium twig, palladium, and platina. All of these remedies, they have the irritability, easily angered nature, and things don't go right. But we saw how we can differentiate in palladium. The irritability is very characteristic. Their right-sided complaint and their bright feeling when they are in a company, and that love of approbation it can be seen. But another difference, I mean, in case of platina, the platina will be very much haughty in nature. You know that superiority complex in case of platina. So this will be one single feature by which they differentiate lilium tigrinum, palladium, and also platina. Now I did some comparison of the drugs. But before that, maybe we go to boric. In case of boric, it is mostly the clinical symptoms. So, in case of boric, it has got a powerful influence over the pelvic organs, and most of the complaints, what we see, the headache or whatever headache, what we learned was in Genosha Ashoka, the uterine complaints being affected. So uterine complaints. So the symptoms that they have is usually a reflex symptoms. It is more often indicated in unmarried women, and the action of the heart is very marked. This is also a good remedy for rheumatic arthritis. There will be pain in the small spots. There is hyperesthesia of retina, but more than that, the symptom is myopic astigmatism. What I told you earlier, where there is a combination of nearsightedness or short-sightedness or myopia with astigmatism, and that is what we saw in the proving. The patient who had astigmatism, when this medicine was given, the symptoms were aggravating, but once the proving was done, she was relieved of even astigmatism. There's an explanation for that. She can read it later. In stomach, they are very much hungry, longing for meat, and thirsty, drinks often and much. In abdomen, they have a bearing down sensation. Urinary complaints, there is a frequent urging with urine, milky, scanty, and hot in nature. There is a constant desire to defecate from pressure in rectum, and that is worse by standing. Another differentiating feature is early morning urgent stool. So when we say about this drug, like the early morning stool, which make the patient to run from the or to get up from the bed and run, and also for dysentery complaints, uh, one of the two important remedies which come into differentiation will be sulfur and mercur. So even sulfur, they have this early morning stool. There are many remedies, but still, Boric, he did the comparison between sulfur and mercur. So not Boric actually. I think it was someone else, Farrington, who did the comparison. So this drug Lilium tigrinum, they are having that early morning diarrhea as like in sulfur, and also dysentery with much mucus and blood and tenesmus as like that of it mercur. Then how do we differentiate? We can differentiate from the characteristic Mendel symptoms itself. The sulfur, the characteristic ragged philosopher nature, the congestion that is felt all throughout their body, then the characteristic constitution, that thin and stoop-shouldered nature. All these symptoms, I mean, what the mind of the sulfur and the mind of the Lilium tigrinum is so different. And in case of mercur, physically, I mean, when we compare only that dysentery symptoms, It is very much similar. Both of them pathologically, when we just take dysentery, the symptoms are very much similar. The tenesmus, the mucus, and the blood, but the differentiation is made based on the mind symptoms. Mercor, they do have only that characteristic physical symptom of the dysentery, not that characteristic mind symptoms. But in case of Lilium tigrinum, the mind symptoms will be very much important. Then in case of heart, the heart being wrapped in a vice, the bursting sensation, the palpitation, angina pectoris with pain radiating to the right arm. Then in case of female, early scanty menses flow only when moving about, and that bearing down sensation as if all the organs, starting from the throat, everywhere that is coming out. There is a constant desire to support the parts externally, can be given for prolapse, subinvolution. Leukorrhea, which will be acrid and brown, and sexual instinct will be awakened. In case of extremities, they cannot walk on uneven ground. We told that it is already indicated in rheumatic arthritis, so all the small joints will be affected. There will be pricking pain in the finger, pain in ankle joint. They have a leg ache and cannot keep them still, or there will be frigidity. Pain in right arm and hip, doesn't matter that much. And sleep, there will be unrefreshing sleep. Aggravation is from constellation and warm room, as like in, the warm room aggravation we see in pulsatilla, but constellation amelioration in case of pulsatilla. And amelioration is from fresh air, even in case of pulsatilla. The comparison is the same remedies, and we go to the comparison now. It's already 4:40. Thought of taking it at just also. So comparison doing with Lilium tigrinum and sepia. In Lilium tigrinum, when they do have the prolapse condition, they have to divert their mind by busying about, or even their sexual desire will be reverted or suppressed by making by themselves busy. But in case of sepia, they get an amelioration when they are doing some violent exertion. If you remember sepia, they will be always going to some violent dancing movement to get an amelioration. Then leukorrhea, there is in case of sepia and also Lilium tigrinum. Both are actually staining, very much excoriating. But when we take the degree of excoriation, the leukorrhea in case of Lilium tigrinum is more excoriating than that of sepia. Then in case the timing, Lilium tigrinum, they have an aggravation in the afternoon. In case of sepia, there is amelioration in the afternoon. A pressure-like sensation they feel in the anus in case of Lilium tigrinum, and in sepia it is a sensation as if like a heavy ball in the anal region. And in case of Lilium tigrinum, they have to or the prolapse is ameliorated by pressing up the vulva with hands or sitting down. But in case of prolapse or in sepia, it will be by amelioration by cross legs. Then dragging down, as I already told, everything, the pelvic viscera, the whole abdominal contents from the chest, shoulders, everything is coming out. But in case of sepia, it is only the uterus that is being dragged down. And it will be a more chronic condition. Lilium tigrinum can be given for a acute condition of a prolapse, but sepia usually given for a chronic uterine prolapse with that characteristic cachexia. And the sexual desire, there is increased sexual desire in Lilium tigrinum, whereas in sepia, there is an indifference or there is an aversion to coitus. Now comparing Lilium tigrinum with pulsatilla, so is some of the pain nature, that pain being radiating, that is same over here. One that I kept in black are actually the similar symptoms: aggravation in warm room and amelioration in open air. The scanty menses and taste of blood felt in the mouth. These three symptoms are similar in Lilium tigrinum and pulsatilla. But then where it is varying is they do have, in case of Lilium tigrinum, consolation is aggravation, and pulsatilla, consolation is amelioration. In Lilium tigrinum, it's like a spasmodic weeping, and then coming out in a flashes, like a flooding will be there when they're stuck, the sadness, or they're crying. It is more of spasmodic in nature and coming out in flashes. But in pulsatilla, it is like a quite weeping. And the tendency to prolapse, amelioration by support, we can't see that symptom. The pulsatilla, we don't have the prolapse of uterus. That's the difference between Lilium twig and pulsatilla. Comparison of Lilium tigrinum and Helonius. Uh, so in case of Lilium twig, there is a dullness of intellect. They are always in a hurry, very much distressed because of a apprehension of a serious malady. But in Helonius, they do have a profound melancholy with a consciousness of womb. Now, how exactly we differentiate this is what I saw in one of the textbook, mostly maybe Farrington. But in other way, if we are going to differentiate, in Helonius, we see the melancholy in nature, that they are always crying, that profound crying. But in Lilium tigrinum also there is profound depression. Yes, but they don't have this. I mean, Helonius, they don't have that symptoms. Most of the mental symptoms of Lilium tigrinum, like striking the people, or cursing them, or indifference to what being done to her, and that fear of insanity, or there is some organic diseases. Such characteristic mental symptoms is not seen in case of Helonius. And they have that consciousness of womb, which is highly characteristic. But here, rather than the consciousness or the sensation, they are very much bothered about their having a serious malady in case of Lilium tigrinum. And it is also, as I already told, it is not just a sensation. Usually, they will be having some organic pathology. And then they have that confused ideas. Though they have confused ideas, they can't concentrate their mind somewhere. There is dullness of intellect, and they always want to do something very hurry, aimlessly, and Helonius doesn't have that feature. Lilium twig and oramet, especially with the prolapse condition. In Lilium twig, the prolapse is usually happening due to relaxation of ligaments, and oramet, it is due to usually induration or due to some congestion. The weight of the uterus is so enlarged or indurated, and because of that, in case of oramet, the future happens. And there are various other differences also. In oramet, when we take the thing, they are actually having a suicidal tendency. Lilium twig also, but their mind is so varied. This one is having a profound depression. I mean, very much characteristic with a tendency to do suicide. And that feature is not so much characteristic in case of Lilium tigrinum. Though they have melancholy, they have suicidal tendency, but not as intense as like of oramet. And another feature will be Lilium twig. As usually, as I told, it is mostly acute in nature. But oramet, it will be towards the syphilitic tendency when there is an actual distraction, both in the mental and emotional level. And they don't have this increased sexual desire in case of oramet. Then Lilium tigrinum, comparison with cactus, uh, for the heart complaint actually. So in Lilium tigrinum also we say that there is a grasping with that vice or the iron band. But the constriction sensation in case of Lilium twig is mostly intermittent. But here in case of cactus, it is mostly continuous. And in Lilium twig, along with this heart complaint, there will be uterine or ovarian complaints. But cactus doesn't have any uterine or ovarian complaints. So that is the main important drugs, how that comparison has been made. Now moving towards Kent's Materia Medica, what he has told about Lilium tigrinum. So this medicine, Lilium tigrinum, it's suited for hysterical women. They should be having uterine complaint, cardiac complaint, some nervous manifestations, or the mind symptoms where they are extremely irritable, some fanciful notions, insanity, religious melancholy, that they are tormented about this salvation, and so many imaginations and fears. And these conditions should alternate. When the mental symptoms are there, the physical symptoms should be relieved, like in case of actor Racimos also. So the mind, heart, and the uterine symptoms, they rotate or they alternate. There is a dragging down sensation, and I explained many times what is the dragging down sensation over here. There is fidgetiness and also palpitation. She can hardly speak a decent word to anybody. She will snap even when she is when spoken to her very kindly. The patient will sit still and brood and think over the past, and when someone is speaking to her, she will jump up and run hastily and excitedly and slam the door without any cause. When spoken to kindly by members of the family or a friend, it seems that she will go wild. This is how Kent has explained her wild, crazy, confused situation. Somewhere she's sitting there and thinking about the past, the brooding over there, and when someone is coming out extremely insaneous, she's jumping, she's moving hastily, running, and slamming the door. She feels like to free from there. That is the kind of confusion or the crazy thoughts that they have. So this is an anecdote given by Kent, a patient who once had an aggravation from this remedy. Maybe he had given Lilium tigrinum, and then she was saying, "I was spoken today in a street car, and I was so mad I wanted to fling something at his head to the driver." So such a kind of madness they will be showing. She was thinking over something about herself and she didn't want to get disturbed. And when someone spoke to her, even when it was very kind, she was in a violent state of temper, a violent state of irritability, a loss of a balance of her thoughts, and she felt that she must fly when spoken to or being disturbed. So that's the kind of person. The patient suffocates in a crowded room. That is why how we see that they are aggravated in a warm room, an ameliorate and open air. So the patient suffocates in a crowded room, in a theater, in a church, like that of Apis, Caliadide, Lycopodium, and Pulsatilla. The provers, they were using the expression, the crazy feeling, as if she would go crazy. And Kent explained, and as I already told you, this crazy feeling was that they were so confused that they were not able to concentrate on one thing. That was the one reason for their aimless, hurried nature also. And they have that characteristic inveterate and troublesome constipation. They have tendency to urinate as well as urging to stool. Sit a long time with much urging, and after long straining, there won't be any stool, as like in alumina. There can be hemorrhoids, especially after delivery, with much bearing down pain, as if it would fall via the vagina. So it does not mean that after delivery, if someone is developing hemorrhoids, Lilium tigrinum is actually a snapshot or a single remedy which can magically cure the hemorrhoids post delivery. But Ken says if this hemorrhoids is being developed in such a constitution, that characteristic Mendel constitution, it is not only hemorrhoids we can cure with Lilium tigrinum, but that uterus, the relaxed uterus or vagina, or the prolapsed uterus, or the malposition vagina, we can correct with that. Then the menses is scanty, which we have already told, and the heart being grasped or squeezed in a vice. Then coming towards Farrington have mentioned Lilium tigrinum. There is problem with the venous circulation, and most of our complaints are actually reflect symptoms from the uterine complaints. There is nervous irritability, that is why there is a desire to be busy, but they don't want to do much. Depressed feeling, incurable of disease, of accidents, which we already saw. Then this can be with, so that it is a good remedy for rheumatic arthritis. The small joints, the ankle joints, finger joints will be affecting. There is a burning, but there is another important sensation for the cracking from deficient synovial fluid. Lilium tigrinum is a good remedy. Oh, here is where I explain what is subinvolution. The uterus does not regain its normal size, and the lochia lasts too long. The leukorrhea, the characteristic leukorrhea, and when we are comparing in sepia, as I told, leukorrhea is highly excoriating in case of Lilium tigrinum. Then urine passes, it causes burning and smarting, and early morning diarrhea, similar to sulfur. And here is where we did the differentiation, how it can be differentiated from sulfur and Lilium tigrinum. Then in case of NASH, there is a great bearing down pain as if the contents will be coming out, amelioration by pressing with the hand. There is sensation of constriction in heart, frequent desire for stool and urine, tormented about her salvation. Almost the symptoms that we learned in case of, what we saw in Alan's keynote, listless, restless, hurried manner, but they don't want to do anything as like in argentum nitricum. I'm just saying because we had already done that with the depression of spirits. So put in short, Lilium tigrinum, a left-sided remedy with all the crazy thoughts, with that increased sexual desire, obscene thoughts, physical symptoms and the mental symptoms alternate, the heart complaints, the palpitation, the prolapse, but it is not just confined to the uterus, but all the organs from the throat, they feel like that, a dragging down sensation. Then heart complaint, the angina, amelioration lying on left side, angina pain radiating to right side, a good remedy for rheumatic heart complaints. That is mainly the feature of Lilium tigrinum. Stop over here. There was Justicia also, but Justicia there is a lot, I think. You want me to take Justicia or I stop over here? What you want me to do? Four pages are there. Someone please reply. You want me to stop?
Yeah, can continue.
Can?
Yeah, sure.
Okay. As like earlier itself, I told the Justicia. I don't know whether you'll get it. It's like just in the syllabus that I'm doing this, only for the respiratory complaints actually. But there are a lot of symptoms given. So Justicia adathoda or Basaka, or its common name is Vasaka. The common name is actually Singi and also Vasaka, and lot other names are there because it's an Indian remedy. Regional names are also given in Boric. The prover is Dr. S.C. Ghosh, and part used is fresh leaf juice. This is Justicia. And usually this is a good remedy for the respiratory complaints, the acute catarrhal condition, especially in the beginning, mostly if it is dry condition actually. The mind, irritable, easily angered, sensitive to external impressions. I don't know whether you should learn these all things. In head, there will be dull aching pain. There can be vertigo. There will be lacrimation with coryza that is profuse. In nose, the coryza, which is very profuse, thin, watery, especially in the morning. But in the night, there will be acrid discharge with blockage. For the namesake, remember these drugs. Mostly, I won't be asking you. Then there is a constant sneezing with loss of smell, post-nasal catarrh, and they are very sensitive to dust, catching cold very easily. Then going towards the mouth, there is profuse thirst, pain in the throat or tonsillitis. Stomach these symptoms, we directly go to respiratory complaints. There is respiratory complaints from dust. And when we say dust complaints or dust allergy, uh, any other medicine that is very important? Yeah, I have put it over there. Did you see? I don't know. The dust allergy, the medicine. So here there is a dust and that leading to the acute catarrhal conditions. Justicia is given, but we have some three remedies actually very much important for the dust complaint. Bromium. Whenever a patient is coming to you and they say they do have symptoms when they open the old book or some of their old dresses, the dust that is coming up, and they immediately started sneezing, and then the respiratory complaints are developing. The one of the best remedy will be bromium. Bromium is exactly indicated. Another remedy will be arundo, the same, the dust allergy, and then leading to the respiratory complaints. But in case of arundo, itching will be very prominent all throughout the nasopharyngeal region. They will be feeling very much itching. That is prominent of arundo. Another important medicine where there is allergy from the dust will be pothos fetidus. And in case of pothos fetidus, it's actually a passing of stool that gives amelioration. So coming back to the respiratory complaints of Justicia, so they have the complaints from dust. There is hoarseness of voice. Mostly there is dry cough. The dry cough is what the important feature. So a patient is coming to you and with dry cough, that leading with, that associated with dyspnea and suffocation, Justicia is a good remedy. But I have given Justicia, okay, and it never worked. That's why I have got so many in my initial stage of practice when I was not at all confident. I used to try with all these tinctures, thinking that I will get an instant amelioration or something, but I never got an action. So that is why then I completely stopped all these tinctures and started giving the main potency, because whenever there is a dry cough, mostly that complaint can be ameliorated by the medicine Bryonia and Spongia. So after I found out that it is not, we study it in case both the drug Bryonia and Spongia, the dry cough. But clinically, when I got the results, then for dry cough, I never think about any other remedy. But that is the feature of Justicia, that dry cough, which is spasmodic, barking, rattling, whatever, blah, 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 whatever you say. It is the dryness that is highly characteristic feature. And so I keep this one also from dust. Then cough with thick expectoration, yellow, worse at night. So there is a contradiction of symptoms over here. Sometimes it says dry cough and then it says thick expectoration. But that is with the tinctures actually. Then it can be also given for fever with chill, headache, and rapid pulse, and small reddish eruptions with itching. But if at all you want to study for exam, just study only this respiratory complaints. So in relationship, this comes somewhere in between allium cepa and euphrasia. You should be given third potency and higher. Severe aggravation can be noticed from lower potencies. And another explanation is given actually in Pathak because it's an Indian remedy. So this is a very useful remedy for the acute catarrhal conditions where there is lacrimation, sneezing, and loss of smell and taste. And when we say lacrimation, the remedy what comes into our memory will be allium cepa and euphrasia. So it is somewhere in middle, and you know how to differentiate allium cepa and euphrasia. The coryza, if at all there is, it will be fluent, acrid, violent sneezing, asthmatic attacks with tightness of chest as if it would burst. There can be stiffening out of the chest with trembling convulsions, cough or fever. Can be also given for whooping cough. Do you know what are the another remedies for whooping cough? Whooping cough. No, I'm not going to say. I don't know whether you people are there already. Yes.
Spongia.
Can I suggest mephititis?
Yeah. You see?
Hello?
Hmm?
Yeah, can I suggest Mephitis, Rheumax, the whooping cough?
You told me Mephitis, right, Lenny?
Yeah,
Yeah,
Mephitis.
Mephitis I have written. It's Rumex.
Hmm?
Something with C. Actually, three remedies. Three remedies with C. Can you see me?
Rosella?
Drosera, yes.
Let's see. Hmm? Okay. I'm not sure. Can I suggest if I
Yes.
back, huh?
Epitech. Epitech, yes.
Huh?
I think actually what it is. It's Epitech. So, and also with C, no one is saying me with C. Choose three remedies are there with C.
Materia.
Carbo wedge?
No.
C remedy. Cuprum.
Yeah, yeah.
And Todd?
Antimtat, yes.
And
Right?
Name. Did you answer? I'm not hearing. Did you say Bryonia?
Yes, Rayon.
Yeah, well, not think of, but because that will be
Cocaria?
characteristic this one. But yeah, I don't know. Then we are going into more of cough remedies. Okay. Bryonia. I want a specific for
Coccus?
actually this one.
Coccus.
One more with C. This one we studied last class, last or one of the class.
Calcaria?
Last class did you study? That we learned in this semester.
Crotalus, huh? Can I say? Can I also look for Crotalus horridus?
Totalis horridus. Whooping cough. No, it will be for the septicemic conditions mostly. Whooping cough when finally the person has gone into a state of septicemia. Yeah. Cuprum we have put. Cuprum we have put.
Okay.
No one is saying me.
Corarium.
So this will be the symptoms. If at all I'm saying for exam purpose, yeah, the sneezing, the lacrimation, loss of smell and taste, then that will be the dry cough, the whooping cough, and puffy hands. Or an edematous condition. This much features will be enough in case of exam. So there is a dust aggravation. Don't forget those dust aggravation remedies, bromium, arindo, pothos, and another will be another one. Can you see me? I don't know. Have you heard it is a rare remedy, Vaitya? Then is other remedy which is cassia, but I'm not doing it because it is also a tincture. I'm not sure whether you are going to get that remedy over here. Until you get that, there is no meaning in studying that medicine. So this is the remedies for short for today. Remember Helonius and Lilium tigrinum, both remedies for prolapse with two different constitutions. Then we have Genosia ashoka and Justicia adaptoda, Genosia for amenorrhea and menorrhagia, And then Justicia for respiratory complaints, especially asthma and dust allergy, and dryness should be the feature. If it is more with a expectation, then Grantilia could be gone. But if it is very dry, it's usually Justicia if a tincture has to be given. So that's all for today. But I stop the recording.